Hey, let's talk about something no one connects properly, vitamin B12 and the vagus nerve. Because if you've been dealing with bloating after meals, random chest pressure, weird bowel urges, delayed ejaculation, brain fog, itchy skin, or even just a general sense that your body is short-circuiting, it's not random. It's not just stress. It's not in your head. More often than not, it's your nerves misfiring. And one nerve in particular, the vagus nerve. And guess what? That thing runs on vitamin B12 like your car runs on fuel. What is the vagus nerve? The vagus nerve is the master communicator between your brain and your gut. It's part of your autonomic nervous system, meaning it controls all the stuff you don't think about. Digestion, heart rate, breathing, arousal, even your gag reflex. It starts in your brainstem, winds down through your neck, touches your heart, lungs, stomach, intestines, even your genitals. It's a big deal. So when your vagus nerve is inflamed, underfed, or underfunctioning, you feel like crap in ways that doctors often miss. What does that look like? If your vagus nerve isn't working right, here's what happens. You get tightness under your ribs or a full stomach even after small meals. You get bloating, acid reflux, or a pressure sensation that makes you feel like you have to sit up straight just to breathe. You feel a twinge or ache near the left nipple and panic, thinking it's your heart. You have bowel urgency after eating, sometimes IBS-like, shifts between stuck and loose. You lose sexual arousal, delay in ejaculation, or reduce sensitivity in the genitals. You get brain fog, poor sleep, anxiety out of nowhere. That's not one problem. That's a vagus nerve running low on power. So where does vitamin B12 come in? Vitamin B12 is one of the core nutrients needed for myelin repair. That's the insulation around your nerves. No B12 equals slow signals, misfires, numbness, poor coordination, and your vagus nerve is especially sensitive because of how long and delicate it is. It controls gut contractions, sphincter tone, heart rate modulation, erectile response, mood regulation, inflammatory reflexes. When B12 drops, the vagus nerve gets sluggish. It can't control your gut. You feel bloated. It can't pace your heart. You feel chest pressure. It can't signal your genitals. You feel numb or delayed. It can't calm your brain. You feel wired, foggy, or both. Why don't doctors tell you this? Because most tests for B12 show a number like 200 or 300 picograms per milliliter, and they say, you're fine. But here's the truth. Anything under 400 is already suboptimal for nerve function. Anything under 250 is already causing nerve inflammation. Anything under 200 is clinical deficiency. But damage starts before that. And most people eating normal food still become deficient because of absorption issues. Low stomach acid, gut inflammation, alcohol, PPIS, even stress. So it's not about what you eat, it's about what you absorb. Here's what you can do if this sounds like you and your B12 is low or borderline. Start with methylcobalamin B12, sublingual, 2,500 to 5,000 micrograms every other day to start. Keep it away from magnesium, fish oil, zinc. Take it on empty stomach. Stay on it for at least 8 weeks. Nerve healing isn't overnight. Track changes, brain clarity, digestion ease, erections, mood. Pair it with zinc and magnesium. Not at the same time, but in the same day. And eat slower, breathe deeper, help your vagus reset. You're not broken, you're malfunctioning. Your body isn't weak, it's just not getting the signal. And the signal runs through the vagus. The vagus runs on B12. This one nutrient touches everything. Gut, brain, libido, energy, skin, sleep. It doesn't fix everything on its own, but without it, nothing else works right. So if you're tired of feeling off and don't know why, start with your nerves, Start with B12. Start with getting that signal back online. That's it.